loss of consciousness. That's one. Or most of the time in children, especially children less than 5 years, you see them fitting, or what we sometimes we say seesaws. So the other thing in children, they may not be able to eat. And the other thing also, it is always accompanied by children vomiting. Anything they take comes out. They vomit it completely, so nothing stays in the stomach. So these are, to some extent, these are characteristics of severe malaria. If you go to the lab and they check you, most of the time they become anemic. And usually it is severe. They have severe anemia of less than 5 grams or 5 grams per deciliter. So these are the characteristics of what we call, in medical terms or in clinical terms, what we call clinical features of severe malaria. And they are most of the time life-threatening. They require urgent medical attention. Otherwise, they may lead to a child dying, or if the child does not die, he may recover with some residual effect of that effects of severe malaria. So it is a very fatal condition, severe malaria.
What is malaria statistics like in the Gambia? Perhaps on a yearly basis, how many cases of malaria is recorded? And does this number actually deteriorate every year, or the number is actually on the rise?
Over the past years, what we realized that malaria is going down instead of going up. It is going down.
Yearly?
Yearly, yes. I may not be able to give you the actual statistics, but from what we have gathered from our health facility cases, we have realized that the malaria is going down on a yearly basis. Although, like if you look at the yearly basis, during the rainy season, we have more malaria cases than during the dry season. But if you look at on an annual basis of our malaria cases, it has gone down compared to 10 years ago and now. So malaria is going down because of a result of multiple interventions we are using, because we are using insecticide-treated net, which we distribute to the general population at no cost. Additionally, we also embark on indoor-residual spraying across the entire country. But also, which we will discuss later, we are also providing effective medicines, anti-malarial medicines, in our public health facilities, in our NGO facilities, and some of the private clinics. Whoever gets sick, you go to that facility and get these effective medicines so that you are treated effectively and the parasite, or you'll be cured of malaria.
Now, global statistics show that 655,000 people, which is almost 500,000 people, die yearly of malaria. And what is so staggering about that figure is malaria is both preventable and it is also curable. Now, what, in your own opinion, having been in dealing with malaria cases and your vast knowledge of malaria, what do you think is responsible for that steady rise in number if the disease is both preventable and curable, looking at the global aspect of it?
Malaria, like I said, is a public health disease. And it is a disease that is very common in sub-Saharan Africa. The statistics we have quoted is more in sub-Saharan Africa. But malaria is a socio-economic disease. It is a health problem, but also a socio-economic condition. Why malaria is common and is devastating in, like I said, in sub-Saharan Africa. Over the years, we have realized that the global efforts that has been mobilized in order to reduce malaria in sub-Saharan Africa.
Near zero malaria deaths by 2015. I think, it's something that the Gambia is working towards. Like I said earlier, in our malaria policy, in our malaria strategic plan, our goal is to reach malaria pre-elimination by 2015. We're some 2-3 years away from 2015, but we're seeing results. If we strengthen what we have, we are definitely going to achieve that. It's possible for us, Gambia.
It's possible.
Gambia, it's not like other countries. We have made a lot of achievements. We have made a lot of efforts. All that we need now is to consolidate those gains that we need, that we have made, and then leap ahead for pre-elimination, for near zero deaths. Because we've conducted some studies with some partners, MRC basically, and we have seen that malaria morbidity dropped by 75%. Malaria attributable deaths dropped by 90%. Those are really gains.